Hello and welcome to the Able to Care podcast. It's me, the host, Andy Baker. And today we're going to be talking about autism in girls. So first off, I'll welcome my co-host, so Nadine.
Hi.
And also a special guest that we've got joining us this week, which is Alex Bond. So
Hello.
Hello. So Alex is a museum curator. I know I wouldn't be able to say that word right. So a museum curator, can't do it, who got diagnosed with autism only, a year ago today, you said?
Yeah, yes. A year ago this week.
A year ago this week. And also her daughter was diagnosed with autism in 2019. So we thought it was a wonderful opportunity to bring Alex along today to talk about the subject of autism in girls. We decided to kind of run this as a podcast, and we're doing a bit of a kind of a special promotion and trying to raise awareness on this subject a little bit. We've got Able Training, we've got a new course coming out related to this to try and raise some awareness and understanding around a subject that is often misunderstood. And I think both Nadine and I feel quite passionate about it, of kind of trying to raise awareness about this. So, right, well, first off, thank you very much for joining and welcome.
Thank you very much for having me.
That's all right. So, well, first off, I think it's probably worthwhile maybe the three of us kind of discussing as far as what we're aware of, as far as the differences in, or why it's worthwhile having a podcast and talking about a subject of autism in girls. So if it's okay, we'll start with kind of Nadine's kind of perspective, because I think you kind of led the way a little bit on wanting to develop this course and wanting to do this subject. So do you want to start us off?
Well, obviously we do a lot of autism awareness courses. We do like the half day, full days, and within the courses it does stipulate that it's quite more difficult to get a diagnosis within girls. It's not something we really overly expand on, is it, within the courses? We generally talk about the masking and that girls are generally better at mimicking other people and those sorts of things, but we didn't really delve into too much as to why it is often not diagnosed or misdiagnosed for something else. And statistic wise, there is more and more older ladies or older females that are going for those diagnoses, and it was just an area of interest. And having done a bit of training on it myself, a bit of CPD, I was just quite fascinated with how often it is missed, and when going through the diagnosis process, how it's not actually catered for the female gender. So I was quite shocked about that. So it's just led me down a bit of a garden path, and I'm just so intrigued by it, to be honest. And yeah,
definitely. I think it's one of those things with autism. There is obviously I've come across quite a few girls with a diagnosis of autism through in the health and social care, but they tend to have those quite severe traits, or the more kind of obvious traits of autism, and commonly associated with learning disabilities at the same time. So I think it's the autism in girls that what would have been Asperger's potentially within boys that then tends to be being the one that's kind of missed commonly within girls and misdiagnosed a lot of the time. So do you want to tell us a little bit about your kind of journey and how you maybe starting off, because I think it was your daughter, obviously your daughter first that started the journey, wasn't it? So
yeah, that's right. So my journey with it really started when Ava was quite young. She's now 12 years old. By the time she was 4, it was apparent that she perhaps was a little different to other children of her age, particularly other girls of her age. And as she got older, some of the traits when she was very small that we'd said, oh, she's so wild, she's so free, she's such a free spirit, she's got so much energy, that actually those traits that you would assume would start to calm down as she got older became more pronounced, and those behaviours became more apparently different to those of her peers. And when she got to 8, we made the decision that now is the time, we need to get this investigated further. We need to see if there is something there that she needs some additional support with, because she was struggling socially, she was struggling at school. And then when she came home, she was having some quite monumental meltdowns because she had been trying so hard to hold herself together in public and at school. So that's really my start point anyway.
Was it kind of picked up by anybody else, or was it you that kind of flagged it and kind of recognized this is different?
Yeah, it was very much me on my own at first. It wasn't recognised more widely within my own family even. I think that comes from the fact that, diagnosed or not, there are a lot of neurodiverse people within my family and within my daughter's father's family as well.
Yeah.
So a lot of it was like, oh, but she's just like auntie so-and-so, or she's just like granddad, or she's just like, and it's like, yes, but have we looked at ourselves? You know, perhaps all of our behaviours don't really fit into this normal, in inverted commas, box either.
Yeah.
So I started pushing for it when I began struggling with her behaviour at home.
Mm-hmm.
And I spoke to her school about it, who were very, very resistant to the idea that there was anything amiss. They were very clear that she was perfectly behaved at school, that she was quiet, that she never caused any trouble, that she just sort of sat quietly. And I said, well, does she join in with her peers in the playground? Yes, she has one friend. Does she join in with lessons? No, she never puts her hand up. And by this point, she was in year 4. And I said, so you're telling me that in 4 years at school, she has never contributed in class, and you don't think that's potentially an issue?
Yeah.
And it took a lot of persistence from me to really get past that and to get them to agree to do the referral, because it has to come from the school. Yeah,
absolutely. Did you think, did you go in with the kind of idea that it was going to be autism, or did you have ADHD in your mind from what you said there?
Yeah, I thought it was ADHD.
Yeah.
I was surprised when autism started being suggested, and when it was suggested that she went down the ADOS path. That was after the first meeting with the paediatrician that tested her, though, who spent an hour with her and said, we need to test for autism. This isn't ADHD.
Right. Okay. Because I think both of them are often missed in girls for exactly the same reason. You said, oh, they're so quiet. So straight away, if they're quiet, they can't be ADHD. If they're quiet, they can't be autistic. It's, it's that counterintuitive, isn't it? But and the label of just shy, which I think is something you were chatting about before, wasn't it, as well? Yeah. So as you started going down that journey, how long did it take to get the diagnosis for your daughter?
3 years in total. We did have the pandemic to contend with as well. So, but I think that's still within the realms of normality now in a post-COVID world. You're still looking at 2 to 4 years from that first referral. It is very long. There are long waits between each assessment as well. So Ava had her first assessment, the one where it was suggested that we should look towards ADOS and autism.
Yeah.
It was then 2 years before she had her speech and language therapy appointment. So that's a long time. And in those 2 years, between being nearly 8 and being nearly 10, that's a world of difference in terms of a child's development, their personality, and the problems that they're facing as well.
Yeah, definitely. Did anybody around that time, as soon as it started being slightly flagged, did you start to adjust anything that you did, or did the school kind of get on board a little bit more with the kind of the suspicion kind of thing?
The school did not want to believe that Ava was autistic until the diagnosis came through. So there were no adjustments made. There was no understanding. The teachers did not want to discuss her with me at all. It was a very poor experience on that end. However, at home, as soon as she was put on that pathway, we decided to look into how we should treat her, assuming that she has autism.
Yeah.
And that way, I found for myself a lot of the frustration that I had felt as a parent towards her struggling with things that other children would find very easy became so much less, because I started doing research into autism in girls specifically and started to think, okay, I can see that she's not being difficult. She just can't get past this barrier that other people can't see. And my expectations, the behavior that I expected from Ava, changed. Whereas I had set the bar quite high for my behavioural standards for my older child, with Ava, suddenly I thought, no, we need to accept that her best is her best. And if she's trying her best, we need to know when to sort of throw in the towel and say, Ava has had enough.
Yeah.
Let's stop this now.
So it's a big thing with behavioural management, isn't it? The kind of the adjusting our own expectations allows us to then notice the strengths rather than the weaknesses. I think that's the thing, isn't it, as well? That when your expectations are up here, they're always going to fall short. And unfortunately, that's one of the problems that they see in themselves, not just that they see from the parents. In fact, that they've been labelled as the naughty kid who doesn't listen, or they're being defiant, not that they are struggling to comprehend, understand, or process the information. So suddenly the kid who's getting labelled as defiant suddenly going, oh, wait, no, they're not doing it on purpose, and the expectations shift. As soon as the expectation shifts, you start to notice the times that they process it more quickly, that they get it quite quickly, and they're like, oh, that was nice. She smashed that.
Yeah, I think it's often us, isn't it? Sometimes as parents with the problem. So obviously, just personal experience. Family member that at parties, she's expected to join in, partake, and enjoy it. She don't really want to do any of it. Obviously, we've spoken before about traits and stuff, and then it was kind of like an argument that she didn't want to join in. It's like, well, you should be having fun and you should be having a good time.
And also, I think what we discussed earlier, an incident recently, last weekend actually, where we went out for a meal. We went to a new place. It was all very loud. It was exciting. You know, we were with quite a large group. She wasn't familiar with the food or the surroundings, and she managed a tiny amount of her main course, and then pudding came and it became completely overwhelming, and she shut down.
Yeah.
And managed to eat her pudding after about 20 minutes, but completely disassociated and ended up sitting in silence with her spoon in her hand for a good 15 minutes while she processed what was happening. Afterwards, she said that the pudding had been delicious and that she'd had a really nice meal. And I think one big thing that I've learned from Ava is that sometimes she is enjoying an event, but it doesn't look as if she's enjoying it. But that doesn't mean that she isn't getting something positive from it. And actually, I need to back off and let her enjoy it in her own way. And if that means sitting quietly and just absorbing the atmosphere and not joining in, that's fine.
Yeah. I think it's really hard for any parent or any person supporting somebody that, again, you tend to judge things based on how you perceive the world, don't you? So if I was enjoying something, this is how I'd act. So I'm assuming that if you're enjoying this, this is how you act. And that's very difficult to step into that very kind of neurodiverse world. And this is, we'll go into masking a little bit in a moment. But I think one of the things you just mentioned there that's really worthwhile being aware of, especially parents and I support, I think meltdowns are now more understood related to autism. I think most people are more willing, if a kid is in a supermarket having a complete meltdown, you might have more people immediately going to the kind of thought process of maybe that kid struggles, maybe that kid's got differences, and therefore that's not a bad parenting. It could be down to this kid struggling. I don't think people are familiar with the shutdown. And I think the meltdown versus shutdown, and we always kind of teach this in a fight, flight, freeze, submit kind of mentality. And this is where your masking comes in, that it doesn't mean that they're okay. If they're going quiet, it might be that they are just absorbing and just need a few moments. But it could be that they're actually really struggling and therefore they disassociate to be able to emotionally cope. And I don't think that isn't going to be picked up on. And it's the same as you said in schools, that, well, which kid's going to get picked up on and constantly getting the parents called in and constantly getting their code flags? The kid who has meltdowns or the kid who has shutdowns? And it's one's disruptive and one isn't. So it's fairly obvious which was going to be. So
Yeah, absolutely. And it takes quite a long time as well to recognise a proper autistic shutdown or sort of dissociative episode. And they are very, very distressing for the person that it's happening to. And I think that isn't understood enough, that the person isn't being quiet and passive. Inside, they are in turmoil, they are panicking, they are frightened. And to try and push them to talk, to try and push them to join in, to try and push them to engage is really damaging in that moment, because you're saying to them, you know, you're already panicked and I want you to do the thing you're panicking about, but do it more. Yeah. And the only way that I can bring Ava out of an episode like that is to back completely off and say, talk to us when you're ready, and then just move the conversation with the group on, leave her on the outside of that group and let her come back to us in her own time and on her own terms. Normally, it's fairly fast, 10, 15 minutes and she'll be okay again.
Yeah.
But the more I push, the longer that's going to go on for.
Yeah. And that's it. I think it's when we talk about things like de-escalation and stuff, we tend to do it from a de-escalation. They're up here and we need to bring them down.
Sure.
We don't always look at it from they're down here and we need to allow them to come up kind of thing, kind of naturally. So, yeah. So as far as your journey of self's concerned, obviously, when you were going through that process, I think you kind of spoke about it. You were starting to, a bit like you were saying with the family members there, they go, oh, they're just like this uncle, they're just like that auntie. And suddenly you started to notice some things related to yourself through the process.
Yeah, absolutely. Yeah. So I never would have associated what I understood autism to be, which is the classic masculine presentation of autism. But then the more I read about autism in women and the way it presents in women, the more I started to think, actually, Ava's just like me. And the ways in which Ava is like me are traits of autism. And then I started talking to my dad about what I was like when I was a child. And he had lots of funny anecdotes, which all relate around hyperfixation, very special interests, things that I would start doing and still be doing 6 hours later. And I sort of thought, that's really interesting because I think maybe that's autism. But the difference is when you have, let's say, the classic presentation in boys, they're fascinated with wheels. They can't stop playing with wheels. They turn their trucks over and spin the wheels. Mm-hmm. Now, if you have a little girl who is completely fascinated with bugs and butterflies and goes out and draws pictures of butterflies, watches butterflies, well, that's classed as normal feminine behavior. Therefore, it will not be flagged as a difference, even if they're doing it for 6 hours a day, 6 days a week. Yeah. So it's about recognizing, I think, that these hyperfixations can look normal and they can be normal, but it's about the extent to which they overtake a child or a young person's life. Yeah. So there were lots of occasions, things that my dad was discussing around my special interests, but then also saying in quite a jovial way that when I was between the ages of 2 and 4, they took me for half a dozen or so hearing tests because they thought I was deaf. And they thought I was deaf because I would be sitting playing on my own and I would be so lost in my own world that I wouldn't respond when they spoke to me. Mm-hmm. Now, of course, if that was a child today, a doctor would say, we need to look at autism, but it was the 80s.
Yeah, absolutely. So that's quite common, isn't it? I think we've spoken about that, the kind of the interests that are specific, say so going from like it's almost a train spotter kind of that stereotype, isn't it? The train spotter stereotype, but then you map that over to more feminine things, and they say it isn't picked up in the same way. Obviously, it's worthwhile mentioning. Obviously, there is many girls with autism out there who can get just as interested in those more masculine kind of, or typically masculine kind of areas and stuff like that. But it could also be ponies, and as you said, butterflies, and maybe they focus on slightly different parts of it as well. Maybe I don't know whether that's I take it. Did you see that much in your daughter as well, looking back on?
Yes, but again, with very age-appropriate and gender-appropriate occupations. Yeah. The current Hasbro My Little Pony series, she knew all of that. It's really silly, but by the time she was 3, she could tell you the whole lore of the land that they live in and all of their backstories and all of their family connections and loads of anecdotes about every single pony. And she would draw them and she would want cuddly toys of them and she would collect the figures and she would watch the program on repeat for days and days and days and days. So it was very much in keeping with a typical 3 to 5 year old girl,
but more intense.
But I would say it's the intensity, and it's the at the exclusion of everything else. So there were no other interests because that was her interest. And she's very much the same now. She will have a fixation that lasts maybe 6 to 12 months, and then she will move on to something else, and then she'll have another fixation. But it's always this incredible deep dive into whatever it is she's fixated on. I have to say now I'm sort of pleased that it's more things like Dungeons and Dragons and less things like My Little Ponies, but it's sort of the extent to which she gets involved with it is the same.
It's obviously the museum curator side of things. Do you think that's your thing? Was that so? History has been your kind of hyper focus?
Not so much history, the natural world, and shell collecting, fossil collecting, paleontology,
right,
archaeology. That was my whole childhood, probably up until my mid-teens, when, I don't know, you hit the teenage years and things change for a bit.
Yeah.
All of your interests go out of the window. But very much that was my thing. All of our family holidays were spent going to the Jurassic Coast down in Dorset, and I would sit with my dad on the beach from dawn until dusk, hitting rocks with a hammer and finding fossils. And I don't remember once being bored or thinking this is going on, because I was completely engrossed.
Yeah.
And similarly, even yesterday, I went to Sutton-on-Sea with the family, and I sat looking for shells in the sand, and suddenly 90 minutes had passed, and Ava had been taking photographs of me sitting with, like a toddler, legs out in front of me, bent over looking through the sand. And so it's still there. And the museum curation is an extension of that. I love collecting, I love collections, I love working in a career that means I work with things and not people as well. So I can get really involved learning the history of the objects that I look after and how to look after them best and how to display them best. And that's the majority of my work, rather than working in a busy office.
And so that's quite a typical autistic trait. It's the attachment to things rather than people. I sort of described that, and I think you do too, that it's objects are predictable, whereas people are unpredictable. So that shell, I always know what it's going to look like. It's always going to do the same thing. I understand it. I can research its background. It never just suddenly gets upset with me for no reason when I don't really understand why it doesn't do what I want it to do. And I think that's why it's for many individuals on the autistic spectrum, I think it is that preoccupation with objects.
Humans are hard work, aren't they? Like we're difficult, all of us. And then again, with the autism side of things, it's trying to understand, well, why is that person upset about this particular thing? I don't understand that. And then there's that expectation on somebody with autism to feel the same way, and then being described as lack of empathy, or or you just don't care, and that's not the truth at all. So I can see why people might want to withdraw. I don't blame them. I feel like it myself.
I think it's pretty maybe worth going into a little bit on the kind of masking side of things at that point then, because I think when we're looking at those on the autistic spectrum, you've got the individuals who. There's some individuals who they don't get people, they don't understand them, they don't make any sense, and therefore they don't enjoy them, because it's a case of, I'd get nothing from it. Why would I spend time or waste my time being sociable, which is something that I don't enjoy doing? So some individuals will disappear into their own world, be a little bit more what we might consider to be recluse and things like that. Whereas I think many individuals on the autistic spectrum, they generally like people, they want to be around people, they just don't always get the appropriate social rules or social norms. So then you get the two that the typical is the kind of the individual who'll talk at you rather than talking with you. So they'll just come and speak and speak and speak and speak and not know when the turn taking is, or not know when it's appropriate time to kind of, hey, I'm interested in what you have to say. But you get the other individuals who are much better at masking it. They have learned the kind of rhythm of speech and the rate of speech of stuff like that. So did you ever find, and would you say for your daughter as well, that you found that you overcompensated, that you learned how to do it? Did you logically think, or was it a cognitive thing that you thought, how do I do this thing? Or was it just something you subconsciously just seemed to be able to get over a period of time?
I think it's something I've grown into. I think it's something that I'm good at public speaking, and I think speaking to people is like public speaking. I apply the same rules that I would apply to standing in front of 200 people and delivering a lecture. I would apply the same rules to talking with a friend in a coffee shop. It's very, very difficult. I find it exhausting. I was very bad at it when I was younger, and used to drink to help get over that. Certainly couldn't socialize without some kind of crutch for a very long time, probably until I was in my late 20s, early 30s. And now that I can do it for short snaps. So sober me can have a conversation with somebody for maybe 90 minutes, but then I need to leave. I run out of steam, and I will actually come to a point where I'll trail off mid-sentence because I just don't have the energy anymore to continue talking. One thing that I find really hard, and have always found really hard, is small talk. I cannot talk to hairdressers. Fortunately, I've had the same hairdresser since I was 16, and he's wonderful, and he just lets me sit in silence while he cuts my hair for me. Because what is the point in that? I don't find that there is anything to be gained from the whole funny weather.
Yeah.
I don't understand how to keep that patter going either. So after a couple of questions, I've got nothing. I might ask you something really personal, and I've been told by a number of people, particularly older people of sort of my parents' generation, that I'm far too prying, that I don't respect personal space, that we just don't want to talk about that. And I thought, but how do I get to know you if I don't find out who you are by asking you about your life experience?
Yeah.
And because I will tell anybody pretty much anything, because I have no shame or regrets, or my life is my life. And why would I be embarrassed by it?
Yeah.
I guess I apply that to everybody and don't understand that perhaps people don't want to talk about mistakes they've made, bad times in their life, etc. Whereas that's the stuff I want to know.
Yeah.
Because by understanding how somebody would react to a terrible situation, I understand them, because I understand what's at their core. Otherwise, all you learn is superficial nonsense that frankly doesn't mean anything. So
as far as the kind of that communication, do you find it's, you said there about 90 minutes of conversation, but if you're talking about something you're passionate about and something that it is, you're able to control that conversation to a certain degree, or I don't mean in control in a negative way. I just mean it like that you can just almost free flow. Is that still 90 minutes, or is that more when you've got to work hard doing the kind of the back and forth chit chat, contemplating what they're saying kind of thing?
I don't know.
Right.
And I don't know because there are very few people that would share my specialist interests. So I don't get to talk about 17th century pirates using slaves as part of their crew very often, for example, but that features in my PhD. So I would talk to somebody about that and they would look at me and go, sure, that's great. Okay, Alex, right, I'm going to go now. So I don't really know. I suppose I could talk for longer, but I would still say that after a couple of hours, I think I'd be done.
Yeah.
I think I'd be done.
I didn't know whether obviously the museum curator side of things, I always think of like talking to the public and stuff like that. So I didn't know whether that was something that you'd had to overcome.
Yeah, that's talking at, though. That's very different. So I'm very comfortable doing lectures, giving tours, speaking about specific objects or collections, but that is in teacher/lecture mode. It's not a conversation. And actually the tours that I've led where they all want to ask lots of questions and talk is great. But again, after an hour, I'm done with that.
Yeah, you're tired out from it.
Tired out now, thank you.
Can I just ask a question? So you know when you have finished and you have had enough, how do you let people know? Is it just get up and walk off, or do you have a thing where you say, right, I'm finished now, I kind of need to get off? Will you excuse yourself?
Yeah, when I was younger, I would just leave.
I love that.
I used to, particularly on nights out as a teenager and in my early 20s, I was always in trouble with my friends for leaving and not telling them I was going. I would go to the toilet in inverted commas, and by the time they realised I wasn't in the pub, I was at home in bed. As an adult, I set myself time limits. So if I go out for dinner with a friend, I will say, I have to get a taxi at 10 p.m. And then I know that I've set myself a reasonable time and I can leave. I also don't really drink alcohol anymore at all because I always want to be able to get in a car when I'm ready and drive home. But I think I've just got much better at setting my own boundaries and recognizing my own limitations and knowing that I can be really good in a social situation, say for 2 hours. So I will just say, if somebody's invited me over for a barbecue at 2 p.m, I'll say, that's great, but I'm going to need to be home by 5. And I'll let them know before I go so that I don't feel anxious then about wanting to leave.
Yeah, an expectation for you to stay.
Yeah, it's sort of, it's just self-management. It's learning your limitations and accepting limitations. And that's been quite hard to sort of say, actually, there are things that I can't do and there are boundaries that I can't push because I'm going to make it miserable for everybody, be that my family or friends or whoever. No one's going to enjoy my company if I'm feeling that I can't manage where we're at and what we're doing.
I feel like Ava's really lucky to have you to be able to talk to about that, because I can imagine it's not an easy thing to recognise within, excuse me, like yourself, and like it's taken you a long time until you're older. So at least it's a nice, really good thing that Ava's got you there to help with that. Like, these are your boundaries, Ava. You don't have to stay. You don't have to keep engaging in conversation. And hopefully that'll help with her anxiety as she gets older.
Yeah, certainly. We spoke earlier around she has great difficulty having friends to stay over. She is actually a very sociable person, and Ava would love to have friends to stay over and have friends to stay over regularly. All of her other friends are having sleepovers. However, when we try to have a friend to sleep over, Ava just can't manage it. We get to 7, 8 p.m. and I can see that Ava is just exhausted because she's been with this person for the whole day and she's done, and she wants her own space and she doesn't want this person in her bedroom, and the friend always looks completely heartbroken. So what because of course they've gone round to stay overnight at a friend's house and the friend won't speak to them. So we've now sort of we've spoken about it, and I said to her, it's okay if this is what a sleepover looks like for you. If for you, it's actually that you guys watch a movie together, the movie finishes at 9 and I give your friend a lift home, so that the last couple of hours that you're together, you're doing something where you don't need to talk, and then you're still staying there till the evening, but then we're separating you and it comes to an end, because she struggles with things having an ambiguous finish time. So if she doesn't know when a social thing is going to stop, that's really hard because she doesn't know how to manage her energy levels so that she has energy for the entire event.
Well, it's that need for predictability, isn't it? It's the there's a wonderful variation of the triad of impairments that was created by somebody who had neurodiversity. So rather than looking at it as difficulties with social communication, social imagination, social interaction, the need for predictability. So we all have a particular need where we want to know what's going on, but it's the level of that need that makes a difference and whether it impacts on our life. The need for motivation was the other side of it, that we all have to have motivation to do things. But a lot of us make an assumption that we should be motivated because that person wants us to. But suddenly within the autistic framework, it's a case of, well, why should that matter to me? That doesn't make any sense. So why would that motivate me to do it? And then it's just the split skills, the cognitive imbalance, where they may have very high levels of ability within certain areas of brain function, but very low in others. And I really enjoyed, or I really like that kind of way of understanding autism, that it shows we're all on it. But I think that need for predictability is quite important. And you just mentioned there, that kind of knowing what's going to happen next. And sometimes knowing when I have got the line means I can better cope leading up to that particular line. Yeah, definitely. So as far as the masking side of things concerned, then, what would you say? And obviously, I don't know whether you want to, my opinion of masking, and maybe it's worthwhile our kind of giving our opinion each of masking, and then for somebody who regularly does it, is that kind of the ability to kind of, well, I use the analogy that many people have been through a period of severe depression, for instance, but they've still managed to attend an event where maybe they had to mask and pretend to be happy, so nobody would have known that they were depressed or they were struggling. It's tiring. It's hard work. Some people seem to be able to see through that mask no matter what, but you can only keep it up for a couple of hours or so, and then you start to feel significantly drained. And that's probably the closest analogy I can kind of think of for myself of what I consider masking to be. Hopefully we'll see how it goes. But what about yourself?
I don't have an analogy. I don't have one of those. With the masking side of things, from the videos I've watched and the people that I've spoke to, I did support a couple of young adults with autism, so
Yeah.
young ladies with autism. The masking side of things, what I tend to find was fitting in. So obviously, I don't want to take it away and do it gender versus gender, but for women, I think it's really hard for us, especially in those teenage years, to be able to fit into society. We try and find our place, our groups, our people, our gangs and stuff like that. So from what I know and who I've worked with, there was a lot of sort of friendship hopping, and it was a little bit, so I'm this person because I want to fit in with this social group. So there was a lot of masking there. Oh, I'm into computer games now because this group of girls like it. And it was a case of, you've never played computer games before, but cool, we'll support you, that's fine. That didn't last very long. And sometimes with the masking in that sort of social friendship way, I found that one of the most difficult things, because they were constantly trying to be somebody who they wasn't, and it just kept catching up with them. So we'd get things like lies, untruths, and we'd have lots of horrible social situations. I'm just thinking of a particular individual that I work with, bless her, and I think she just really struggled knowing who her actual friends were, made her quite vulnerable in the sense that she was so desperate to fit in, and she would mask and be okay with things that she gave away, money, personal possessions, and those kinds of things. So just from that side of things, I think the friendship of masking, so who are my friends and what sort of friends do I actually want to have? And I think that's where I've seen a big struggle there. I don't know if that's relatable to you at all in any sense.
Yeah, I think not. Well, I say not so much now, but I would say for me to be comfortable, completely comfortable with a new person, it's probably 3 to 4 years. It's a long time before I stop being incredibly anxious around people. And I'm told a lot, but that's not who you are at all. You're fine. You chat to everybody. And I think, but you don't understand the cost, and you don't understand how hard that actually is for me to do, and how tiring, and how much I overthink, and how many times I nearly bail on a barbecue or a drink or a social situation because I don't think any of you like me or want to be near me. And that's me talking within the last 5 years. And one really big thing that's come out of my diagnosis is the understanding that I'm not failing at this stuff. This stuff is harder for me than it is for other people. Yeah. I'm not bad with people. I just don't quite understand how to relax with people. And it's, that's going to be a lifelong thing. With masking, I would say that masking is acting. You learn to act, and you learn a script. You learn certain conversations that you're comfortable having, certain conversations that over time you learn that most people are comfortable happening. You can talk to most people about their parents, their pets, and their kids and their jobs. And these are safe conversations that you can have with nearly any, and you can have nearly exactly the same conversation about those subjects with almost any person of any age or background that you meet. So they're nice and safe. And you might, or I might, have those conversations with a certain person 20, 30 times before I'll dare try and start a conversation about anything else. Yeah. Because I don't know if what I'm going to say on another subject might offend them, or, might upset them, or I might completely misread their cues, or I might suddenly talk about pirates for 3 hours. Yeah. Who knows? So it's about sort of managing what your communication is like, and it is just learning to act. And a lot of particularly for girls, and actually I think this one's worth mentioning, I have lots of stims that I do at home that I don't do anywhere else and have never done anywhere else. And that can be finger clipping, flapping my hands, whistling, making vocal tics, etc. And I never do them outside of the house unless I am extremely stressed or extremely anxious. Or I might, do something really silly like hop up and down, squeal, just really the things that you would associate with classic masculine autism. Yeah. But girls learn, or many girls learn, that is not okay in public, and we just suppress it, and we find other things to do. I dig my nails into my palms to stop myself doing other things.
Yeah.
And that's a really big part. So I think for a lot of women with autism, we don't act autistic because we've learned not to.
Yeah.
Yeah. And that's it.
Yeah, it's a really key thing, definitely.
I think something you mentioned there that I think it'd be nice to kind of draw it towards and as we draw it to a close on it. You mentioned something as far as one of the benefits to diagnosis was suddenly the fact of, you know, understanding yourself a little bit more and being able to recognize, okay, this is knowing that the things that you thought were wrong, you just find them more difficult than other people. It's not that you can't, it's not that you're a failure. It's just that, you've got a bigger mountain to climb than most. What would you say are the other benefits, and maybe both for you, as you're aware of for your daughter and for yourself, of getting the diagnosis have been?
So I think there's some real positives for me, having got to where I am in my life, sort of by hook or by crook. And looking back, I'm able to put to bed a lot of the things that I lay in bed thinking about from 10, 20, 30 years ago. Why did I say that? Why did I do that? Why was I weird then? You know, why didn't that person like me? Why did they say I was rude? And now I can look back and say, it's okay. You did okay. You know, you still got here. And being kinder to myself has been a huge thing, giving myself far more grace than I've ever given myself. I used to give myself a really hard time and allow myself to become incredibly anxious and incredibly worked up about feeling that I wasn't able to do enough, perform enough, be enough, do things quickly enough, concentrate for long enough, etc. And now I can just say, actually, I don't have the mental energy to do that today, so I'm going to do it tomorrow, or maybe next week, maybe never. We'll see.
I love that.
But it's such a weight off. And also for me, throughout my life, I have been ignored by doctors, pushed around from doctor to doctor regarding mental health issues. I had a list of diagnoses as long as your arm for mental health conditions, and I was able to go back to my doctor last year and say, I want to review these because I don't think most of these are right. And I think we need to get these scratched off my medical record because I don't think I have half of these. I don't have OCD. I'm autistic. I don't have panic disorder. I'm autistic. So there's a whole weight off there as well. I'm not this huge list of conflicting diagnoses. It's just one. And the one has all of the others that pull into it.
Yeah.
And so again, it's about being kinder to yourself. You know, I'm not a failure because I have anxiety problems. I have anxiety problems because I'm autistic. And that's just great. So for me, it's been life-changing on a very personal level because it has allowed me to be kinder to myself really for the first time in my life. I'm 40 years old and I'm only just accepting that this is just the way I'm made. And it doesn't matter what medication I take, what therapies I try, my brain is not going to change how it works because this is how it works. And for Ava to have that diagnosis so much younger, before she started secondary school, she's able to go into secondary school with the support that she needs to do well. I did atrociously at secondary school because I spent the whole time trying to be a good, well, not a good teenager, but trying to be a teenager and have the social side of things, which I always felt were collapsing in on me and were massively overwhelming. So schoolwork went out of the window completely. Whereas for Ava, she has support, she has support workers, she has counsellors she can talk to, she has a safe, quiet space within the school that she goes to that her and other neurodiverse young people can go to when they need time out, even in the middle of lessons if they need it. And this allows her to do well at school. And her first year came to an end in July, and her school report is just, she's like a different child to the child she was 2 years ago because she understands now how to get the best out of herself. And she's surrounded by teachers that want that for her. So it is hugely, hugely beneficial.
Yeah, it's good. Yeah.
Really good. I'm really happy for her.
Thank you.
Yeah.
Me too.
Me too.
Yeah,
absolutely.
And 40s are supposed to be the best years of your life.
Yeah, I'll go with that.
So you've already kind of mentioned some of the other labels that you'd got, and so I'm not going to go back into that, but I think it is worthwhile kind of just drawing attention to that. I think it is very easy to get lots of different labels, and sometimes kind of it's a keeping exploring, and suddenly one then does supports the others. We always want to try and within our podcasts and within the values of able training, that whether it be dementia, or whether it be autism, or whether it be fetal alcohol spectrum disorder, wherever it is, I think it's always easy to focus on the negatives of the condition. And obviously, especially with something like autism, you know, it isn't curable. It's not a condition, or it's not an issue in the way we may think. It's a difference in the way our brain works. So it's not going to be kind of based on diet or medication that's necessarily going to solve it. So I think it's always worthwhile. What would you say are the positives to being autistic from your point of view?
Okay. I think that I see things around me that other people don't see. Because I'm hypervigilant, which a lot of people might put down to being a negative, but, you know, I don't think it is. Say I go for a walk in the countryside, which I do a lot. I see every different species of grass and plant and flower, and I know them all. I know all of their names. I know all of the different butterflies, the bugs, the birds. I can recognize all of the bird songs. I can hear bats if I go for a walk at dusk. There are 1,000 wonderful, incredible things in the world around us that if I wasn't autistic, I wouldn't even notice. I wouldn't see this stuff. And even if I did, I wouldn't care. And I can't imagine a world so bland and so unenriched by knowing what's around you and valuing what's around you. So for me, and I know it's because the natural world is my special interest, but for me, yesterday at the beach, I was able to tell my 5-year-old son the different species of shell that he was picking up. I could tell him how old the examples were, like, oh, this one was just a baby, or this one was probably 3 to 5 years old. And it's being able to impart that knowledge to my children to enrich their worlds as well. And that's just a tiny part of it. You know, I'm able to hyper focus on projects so that I can decide to do a PhD in my spare time because it interests me, not for any sort of academic accolade, just sort of for something to do. And it's not necessarily because I'm incredibly intelligent. It's because I have that focus and I can say, this is the subject I'm going to read about, and I can read about it for 6 years straight. So again, it gives you an edge in a lot of things if you know how to apply it and if you choose to apply it. And some people might not do, but it's there if you want it.
Yeah, I think that's a nice way of putting it. I think there's a lot of people out there probably think autism is quite a modern thing in some ways, but it's just, we've now got a label for it. It was always there. And I think I remember reading in one place that if it hadn't been for autistic individuals, we wouldn't have survived as a species, because they're the ones hearing the predator coming and out there hunting and gathering and checking for stuff. We would have been in the cave having a chat.
Talking about the weather.
Talking about the weather and making small talk that doesn't really matter to anybody. So, and I always kind of love that kind of analogy that, yeah, there is some things that people engage with that if you take that out of them, if as you say, how much time do people spend kind of engaging in just meeting up for a coffee and just spending that kind of, and suddenly that doesn't mean anything, it doesn't matter, then suddenly the time you're taking for that, you're suddenly putting that time into something that really interests you and really fascinates you, or to engage in a different aspect to life is incredibly enriching rather than necessarily a deficit. It is a positive. Yeah, definitely. Okay. Did you have anything you wanted to kind of add in, or questions or anything like that?
1,000, but when you're ready, we can go for a G&T and do that instead. No, just I just think it's really valuable, especially with the female and girl side of it, because I think there's a lot of still, again, out there, undiagnosed, and people not really knowing who they are and where to go with it. We know that autism within girls at the moment, there's a big proportion as well, struggling with identity in gender and those sorts of things. So I definitely think that's something, I think this podcast will help a little bit in the sense of, well, you are who you are and be who you need to be. And I think that's a really positive thing. So non-binary and transgender in particular, but seems to be more prevalent in autistic girls and women rather than males. So yeah.
The statistics are 67% of people who identify as autistic have some kind of gender dysphoria. My daughter is one of them, although she goes by daughter to me. Yeah. She uses they them pronouns with her friends. We're in the process of waiting for Ava to decide whether she goes by Ava or Ash on a permanent basis. She uses Ash with friends and they them, Ava at home, which is her birth name, and she her, and that's her decision at the moment. And so yeah, there is, as you've said, there's a whole world of confusion for people. I think personally, I would suspect a lot of it comes from the changes to the female body going through puberty are far more noticeable than the changes to the male body, which stays the basic same shape. And just not feeling comfortable in your own skin and not knowing how to reconcile that.
Yeah, definitely. I think it's a good topic of a topic and talking point, definitely, and it's something that I keep coming across on as well. So obviously with our course going forward, it is mentioned in there as well. Yeah. So yeah,
definitely. I think for many people, not feeling, as you said, using the term comfortable in your own skin, but recognizing your own identity and recognizing that whoever you are and however you present is okay, whether that be related to gender. So some people are going to dramatically try and seek out, well, what is right for me? What does work okay for me? And I think this is sometimes a downside of any label to some degree or another, that I desperately need a label because I want to fit into a box. And we like to categorize in this world because it's the way we learn. But I don't think we fit into boxes very well. I think we kind of, it gets all a bit complicated and confusing at that point. But yeah, definitely. Well, we'll draw it to a close from there. Thank you so much for your time today, and I think a lot of people out there will find the stuff that we spoke about today really useful and engaging and stuff. So yeah, really appreciate your time. So thank you very much for joining us, and obviously we'll be back with you next time. Cheers.
Okay. You want to give me one more clap? You just jumped.
Clap's really loud.
I do clap really loud. You do. Yeah.